This webinar, this webinar, pardon me about that instruction. It's just to let you all know that this has been recorded. So this is quite apt. It's Black History Month, and we've got this webinar from ALAFIA. So I'm going to hand over to Michaela now. I'm not going to take too much of your time, and please join me in welcoming Michaela Teti. Thank you.
Hi everyone, good evening. Hopefully it's evening wherever we are, but yeah, if not, yeah, just welcome. I will share my screen now. Can everyone see my screen? Yes, great. Yeah, I guess as Shola said, thank you for inviting me. Thank you to ALAFIA Charity Organization and to Shola for thinking of me and for inviting me to speak here with you today. I like this to be as interactive as possible, so we're going to be using Mentimeter, and also we've got the chats as well. So feel free to put in your comments or your questions in the chat. But then there'll be QR codes, or there'll be kind of instructions to join Menti. So all you need is an internet and maybe a phone. So you can just scan a QR code. It will take you to a web page where we can answer questions and kind of interact with each other live. I'll give more instructions when we get to that point. But yeah, today's topic, as Shola has said, is psychology in mental health, benefits and barriers for Black people. So in true psychology form, we always like to start with the check-in. How's everyone doing? You know, we've all, you know, been through it's been a long week for me, but then I don't know what it's been like for you. So I just wanted to check in. And I personally like to use this blog bridge with my clients, because I feel like everyone interprets each blog quite differently. So if you don't mind just, you know, spending some few seconds to look at this and identify which of these blobs are you. So take a note and we'll move on to the next slide. We use the Mentimeter to kind of put in our comments. So just have a look at this blob, and then yeah, you can put it in the chat, or we'll use Mentimeter as well. So yeah, just spend a few seconds to have a look. How are you doing today? Could be how your week has been as well. So yeah, just have a look. Everyone good? Everyone selected a blob? Yeah? So we'll move to the next slide. So this is the Mentimeter I mentioned. So you can either go to menti.com and put in the code shown on screen, that's 67370899, or you can scan the QR code and on your phone it will take you to this question where you can type in live. It also allows you to put in questions as well. So yeah, feel free to. I can see that one person has joined. We get a live feedback, so we all get to see on the screen how we're all doing. So yeah, please scan the QR code. No need to sign in. You don't need to sign up or sign in, and just scan and then put in your comments. So yeah, we've got one good, and someone's feeling good right now, which is amazing. Would just wait a few seconds to see if we get more response from people. So yeah, hopefully people are able to connect to menti.com. Anyone having challenges with menti.com? Please put it in the chat. I can't see the chat, so I think Shola would have to help with that. Yeah, good. Okay, yeah. Any more response from people? If you're struggling to use menti.com, feel free to just use the chat bar instead. So if you ask me how I'm feeling, I guess I'm feeling a bit tired from this week. It's been a tiring week, but I'm very excited to be here with you today to present on this topic. We'll go into a bit about me, but as Shola said, I'm quite passionate about EDI, and so I'm grateful that I can speak about this during Black History Month as well. So yeah, thanks for the invite. I see that 3 more people have joined. If you don't mind just putting in your response on Menti.
Where did you say there was the just right there?
Pardon?
They're on the phone. Yeah, I'm joining the meeting.
Oh, okay. I'll just move on to the next slide for time purposes, but still feel free to put your comments in the chat. And we'll be using Mentimeter throughout, so maybe just have it on your phone ready for the next question. So yeah, yes, a bit about me. My name is Michaela. I'm originally from Ghana. Woo! I don't know if there's any Ghanaian on this call, but yes, I'm repping Ghana today. But I currently live in and work in the UK in psychology. I work as an assistant clinical psychologist. I also work as an EDI co-lead for the Wigan Borough, which is like an area in Greater Manchester here in the UK. And so yeah, my undergrad was in biochemistry, and you know, after school I started working in the field. I worked a bit in food biochemistry, and then worked for about a year in medical biochemistry. And during that time actually is what kind of stirred my path or my passion to move into psychology, because I would go see the patients on the ward. There was an inpatient setting. Go see the patients, and they would talk to me a lot about what what they're facing, the challenges that they're experiencing mentally, psychologically, and even growing up, I've always had people kind of come to me as a counselor, and to just kind of listen to them, to guide them, to provide some wisdom, and so it felt like a natural kind of career progression for me, or like change of career for me. So I came to the UK, studied a master's in psychology, which was like kind of my, I guess, first point into the field here. My work experience, and so while I was a student, I worked as an international student ambassador in Scotland. So I schooled in Scotland, and during that time, that kind of paved the way for kind of my EDI interest. And so it was more about, I am international, I'm here, I know what it's like, it's not always very easy. And so I'd like to support people who are coming as well. And so that's kind of how it started. And yeah, I'm still kind of very much interested in that same cause, or that same vision of helping international or Black people like me feel very comfortable, or kind of get the right support that they need. I guess in psychology, you always have to kind of, diversify your experience, and, know how to work with different populations and different groups. So I worked with older adults with the British Red Cross as a community connector, support volunteer, moved on to work with kids as a teaching and learning mentor, and then eventually as an assistant psychologist for the NHS in London, and then currently I work in adult mental health. But what I like to say to people, that my identity is not just my profession or what I do, and that it's very important to kind of see that as a part of you, but then not all of you, and find you outside of what you do. And so outside of, being an assistant psychologist, I enjoy walking. I went for a walk today. The sun was out, which is not always the case in the UK, so took advantage of that. Went for a walk. I enjoy music. I enjoy learning about different cultures, and I'm a person of faith as well, so I like to engage in my faith. So I guess that's the start of kind of thinking about mental health and thinking about psychology, to think first of all, who am I, and what am I interested in, what is me outside of my profession, or outside of the main role of your life, maybe being a parent or being a mother, just thinking about you outside of all of those roles. Yeah, so I guess coming back to that topic of psychology, thinking about what is psychology in the first place. So we're going to use Mentimeter. There will be a QR code. And so yeah, if you can scan it, or you can just go to menti.com on your phone and put in the code, and then we can get some response from you. Just so I know like what people's understanding of the topic or the field of psychology is. And so yeah, feel free to just scan the QR code, and yeah, we can all see your response on the screen. I see that 3 people are on Menti now. So yeah, feel free to put in your response to talking. Yeah, so someone thinks of talking when psychology comes to mind. Yeah, okay, yeah. Anyone else? Is there anything in the chat? Like, No. Okay. Okay.
Nothing yet. No.
Okay. Thank you. So I wonder if Lola and Ola have got any comments on, what comes to mind for them when they think of psychology. And we've got, is it Lawuni? sorry, if I'm Ghanaian, so apologies. I'm not. Reading someone's mind and intentions. Ooh, okay, yeah, okay. So we've got changing the way you think. Okay, yeah. The study of the mind. Yeah, okay, yeah. Those are all good. Comments. The study of human behaviors and
Kayla, all I said well-being. I've got well-being in the
well-being.
past. Yeah.
Okay, yeah. So yeah, it's really interesting how kind of, someone specifically said reading someone's mind and intentions. And I mean, it seems like we do that, don't we? Like, it's like, oh, how did they know what I was thinking? How are they able to kind of express how I'm feeling so perfectly than even me? Like, it's like, so yeah, people think that we read minds, but yeah, hopefully at the end of the presentation we'll get to know that we don't actually read minds, we're not like magicians, but it's more through kind of how our practice is, how we're trained, and hence we're kind of, I'd say the key word for psychology or for every psychologist is that we're very observant. So you need to be kind of like observant to kind of understand what's going on for your patients. But yeah, thank you all for your response, and I'm glad Menti is working for you all. So yeah, what's the psychology? I like someone said, talking. We do a lot of talking, don't we? We do a lot of talking. So yes, we do talking. But yeah, it's not just talking. It's not just therapy, as it's popularly called. But we do research. There's clinical practice side of it, and then there's academia. So yes, we've got the research side where usually psychologists are termed scientist practitioners, or especially like those like me, like in the field of clinical psychology, we like to say we're scientist practitioners. So during the training course, you're trained in research, you do, carry on some research projects as well, just to understand more of human behavior through that scientific approach, and yeah, understand mental health threats, be able to kind of get evidence. I guess that's one of the key things, is that a lot of our kind of therapy models, we think of, or we try to have it as more evidence-based, and that comes from having the research part of it. Clinical practice, so doing our therapy, doing the diagnosis, interventions, academia, because we need people to teach us to do therapy, so got the teaching side of it. And so I've got some names of, Black clinical psychologists here in the UK. And I guess going into that topic of benefits and barriers into psychology, while I was searching I even used ChatGPT to see if, they would have a wider list than what I was seeing on Google. But it was shocking actually to notice that there was very few lists or names of Black clinical psychologists, specifically in that clinical psychology field, that came up for even ChatGPT, because they would kind of have a wider search base. And it was very interesting that very few came up there, which was like, whoa, like psychology in itself it's an old field. It's been here for so long. Why is there very few Black clinical psychologists kind of coming up online? And so yeah, just kind of thinking about that. So yeah, I'm a very visual person, so I just thought I'd explain more about psychology and what it's about through this image. So first of all, let's note that, it's not just clinical psychology. We've got lots of different areas or aspects of psychology. So far as something has a name, there'll probably be some form of psychology that can explain or that can work in that field. And so there's even space psychology, which people find surprising. I think that's more in the US, but there's space psychology, okay? And that's an area that I would like to delve into. But yeah, there's developmental, there's the psychology of religion, there's educational psychology, biopsychology, there's social, child, sports as well. We need psychologists in the sports field, health as well, forensic. So yeah, there are different areas of psychology. So thinking about what we do once more. So looking at the image on the left side, so you've got like kind of the human brain shown there with like lots of black and white bubbles up of it. It's just thinking about how most of the time we feel very overwhelmed by situation, we get anxious, we get worried, we get confused sometimes when it's like, it's like your mind is always thinking A, B, and C, and it's hard to kind of have some clarity in your mind. And that's kind of maybe visually how it may look like. Or it may look like, I don't know if you can see my pointer, but it can look like this. It's like a mesh of threads all together. And what as psychologists we try to do is that try to kind of unravel that mesh or unravel that thread. So kind of, someone holding that thread. But then we don't just do it. We do it with the clients. It's supposed to be a teamwork. It's supposed to be kind of a joint collaboration to meet a goal. So that's what we do. We work with the client, together towards a goal. So yeah, we'll try to kind of unravel that to have more of a thin line, a more clear line. And we do that through solving puzzles, because first of all, we need to identify what's going on with the person. Able to piece things together. How do I kind of change this from confusion to make it more clear, through the various interventions that we have to offer. So yeah, so solving those puzzles, and then eventually the person can have more clarity, the person can have more peace, the person can have more calmness, and can then flourish and be more of themselves and do all the things they love to do. And so I like that kind of depiction of, the garden or flowers blooming, blossoming, and they can have more of a quality of life. And I like this image as well because it's got like two people there. And so then when you've got that clarity through the intervention of psychology, you can then build connections, you can build relationships, you can work on lots of different goals. You can be more of yourself. And so this is, part of kind of like what we do. Does that all make sense? Is everyone okay? Yeah, okay. So thinking about, I guess, access into mental health. I know some of us may be in different parts of the world right now, and I just wanted to know, for where you are, do you know how to access mental health support? You can, once again, we're using Mentimeter, so you can scan the QR code, or you can go to menti.com and put in the code 67370899. So do you know how to access mental health support for, in the country you're in or in the state you're in? If it's Nigeria, if it's Ghana, if it's the UK, US, in Europe, in the American regions, wherever you may be. Do you know how to access mental health support? Do you know kind of if there's a national program, if for ways to access support? Do you know what to do? So we've got one no, we've got 3 yeses, yeah. And may I know where people are currently? Is it in the UK, Nigeria? Where are people currently? If you don't mind putting that in the chat. Just so I have an idea of kind of who's on the call. So Shola, you have to help me with the chat because I can't see it.
I was trying to come in there. I've got UK, I've got London, Manchester.
Oh, nice.
That is good. Yeah. I'm waiting to Manchester, waiting to see if there are any Manchester, anyone from, okay, I've got Lagos, Nigeria.
Oh.
That's good. I've got London.
Okay.
London.
Okay.
Manchester. So we have a mix between London and Manchester. And Lagos. I've got Lagos.
We've got someone in Lagos.
I've got Glasgow. That is good.
Yay!
Yeah.
I love Scotland. I used to live there.
So
I love Scotland. Thanks for coming, and thanks for joining all the way from Lagos, from Manchester, from London, from Glasgow. And thank you all for being here. And so it's seeing that some people know how to access mental health support, some no. Okay. So 4 yeses, 1 no. Okay, we'll just move on.
Yeah.
So oh, sorry, did you want to come in, Shola?
No, sorry. I would still say, I think most people on the chats do say they know how to access the mental health support. So we could address the one person that said no. We could address that.
Yeah.
I'll
Yeah, so we'll go through the slide and then maybe you can let us know the one person that does not know if maybe having this information now would kind of help you think about how you can you know, access or find different forms of mental health support where you are. So I guess majority of us are in the UK, and so we probably know what GP means. So that's a general practitioner, if I'm right. I believe it is, yes. So that's a general practitioner. So most often people go to see a GP for physical health reasons, but then they can also help refer you on to mental health kind of support services. So that's usually a more kind of primary point of referral to mental health services. But even in the community, we've got therapy hubs. So thinking about those in Manchester, you know, depending on which part of Manchester you are, for the area of, or with the Greater Manchester NHS Trust. So if you're in, let's say, Trafford, you're in Wigan, you're in Bolton, Lee, you're in, what's the areas in Greater Manchester? You basically, if you're in Greater Manchester region or under the GMMH, Greater Manchester Mental Health NHS Trust region, and we've got a therapy hub website that you can always go to access mental health support. But wherever you are in the UK, there should be some form of therapy hub support or community mental health team. We've got specialist services as well if it has to do with maybe neurodiversity, like autism, ADHD, if you kind of want to assessed or you know someone with that condition that needs more support for the person or for carers or for family, you know, all of that provision is available as well. We've got early intervention, so if there's maybe an experience of psychosis or kind of any form of what we like to say unshared experiences, so kind of hearing voices, hallucinations, delusions, all of that. We've got early intervention teams that are available to help out as well. We've got private clinics, you know, both in the UK, in Ghana, in Nigeria actually. I was looking online to different, you know, mental health services in Nigeria, and I saw quite a few. I was like, whoa, that's really good. So yeah, we've got private clinics, and I know we've got governments kind of run clinics or hospitals in Nigeria and in the UK as well, in Ghana as well. And then we've got online services. The world has now gone very digital, very technologically advanced now, and so yeah, we've got online services. So regardless of where you are in the world, you can still kind of go and access. I know I've heard of betterhelp.com. They offer online services. We've got so urgent care, A&E. So sometimes, depending on the severity of kind of what's going on for you or for someone, you then refer on to urgent care, so going into A&E, or you can just call a crisis helpline if you're in the UK. The number is 111. But wherever you are, it's kind of looking online, what is the kind of the crisis helpline for my region, and you kind of can call or contact for support whenever needed. And yeah, we've got inpatient settings, so this is more of kind of like hospital admissions. So you know how with physical health, some people are kind of admitted into hospitals, so they get to stay in there for a few days to get more intense support, and so that's inpatient even for mental health. And some people get admitted to get care either in psychology, you know, occupational therapy, or even with psychiatry to gain some medication to help them feel a bit better. We've got that provision, and that's kind of all over the world as well. I know Ghana, we've got psychiatric hospitals that offer that inpatient provision. So you can either be there informally, which means that you're not really as restricted in your stay in the hospital. And we've got people who are sectioned. It means that they're kind of detained. They may be there without their kind of consent, but it's due to how unwell they are, and you know, for their best interest, they may need to be in hospital to get some care. So you hear sometimes that someone is being admitted on a section. That's what it means, and it's usually under some form of a mental health act. And we've got charities like ALAFIA. We've got Empathy Northwest for those in kind of Manchester or like the Northwest regions in the UK. We've got a lot of we've got charities also like Mind, like Samaritans. We've got lots of different charities coming up now actually that are focusing on mental health for Black people, for you know ethnic minority, or you know for the wider population in general. And then we've got our very own churches for our Christian fellows. We've got even in schools, in our workplaces, and we've got kind of some form of counseling or some form of support staff attached, pastoral care attached in our schools, even in our churches, because, as Black people, I noticed that a lot of us, our first point of call is usually our pastors or our religious leaders, regardless of what goes on for us. The first people, even before we go to a physical health hospital, we send our message in our group chat or to our pastor, Pastor, pray for me, this person is sick, this person has a headache, or this is going on for this person. So in some ways, they are providing some form of mental health support because they are offering that listening ear, they are offering that guidance, that form of counseling as well. And so we've got that available. So the person that kind of answered no, no pressure, you don't need to comment, but feel free to comment if you can. Just to think about with all this that I've said now, do you think there is some way for you to access mental health support, either from either of these points? Do you think that now you feel like, okay, there is something actually out there for me, I just need to go for it? No pressure from the first start, putting you on the spot, but just want to make sure that the no can be taken.
You are.
That's good. That's good. So yeah.
Yes, it's me.
Okay. You know that.
I suspected I could go to the GP, but because I've never been there, I wasn't sure.
Okay.
Yeah. Yeah.
Thank you.
Yeah. Yeah, thanks, Victor, for the comments. But yeah, it's always helpful to know that, these things are available, whether we need it or not. It's just helpful to know that at any time, whether yourself or your friend or family or someone else in your workplace is needing support, you can kind of signpost, you can guide them towards something that would be helpful for them. So it's just always helpful to have information at hand. So we've got psychological intervention. So, people like me, you go to your GP, they refer you on to talking therapy, or they refer you on to psychology. What do you expect? What's actually going to go on there? So it can either be one-to-one sessions. We've got group sessions as well. And we've got peer support. Peer support means that maybe someone going through a similar condition or situation as you. And person A is experiencing anxiety and mental health and so assistant psychologists, we do a lot of kind of coping skills work and we can find them as to kind of how to deal with whatever it is you're going through. But how we do that, we tend to kind of use evidence-based models like CBT. That's a very popular one, cognitive behavior therapy, which makes you think about kind of and our feelings are all interlinked. And we can use an example. If let's say before you go out for work, right, you put on a dress and you're not too sure if you look the best, you're not too sure if you look good, throughout your day, while you go out, while you step out of the house, you think about it, don't you? You focus on it, and it's hard to kind of take your mind out of it. So that's your thoughts. So one is the behavior, it's kind of what you put on, but you're not too sure of it, and then it goes into your thinking. It's like, oh, do I look my best? And then you notice you try to look out for comments from people, for compliments from people, and it's like, oh, no one has said I look good today. It's like, what does that mean? Does that mean I don't look my best? And then it feeds into your feeling. You feel sad, you feel a bit low because you're like, oh, I'm not the best today. You become more self-conscious, right? But then if you look at it in the other way, if let's say you dress your best, right, you feel more confident. You're like, oh, I look good today, whether people compliment you or not, you're like, yes, you feel empowered, you step out, and that feeds into how you think. You're then able to focus more on the task you have at hand than on what's going, like your appearance. And then you feel better, you feel confident, you feel happy, you feel energized to carry on with your day. So CBT kind of helps us think in our way, that interlink or correlation between our thoughts, our feelings, and our behaviors, and helping us find kind of the loop and kind of how to kind of intersect and what to do to help us deal with situations at hand. So if we feel anxious, what's causing us to feel anxious? Thinking about that and working our way out to find a spot in there to work on that anxiety feeling. Got acceptance commitment therapy. We've got compassion focused therapy, which I quite like and use a lot in my work. And the idea of compassion focused therapy helps us think about it has what we call flows of compassion, which is compassion from us to others. So most often that's what we tend to do, isn't it? It's like, someone needs something. That's compassion. You're all out to kind of give them money, resources, even visiting them, even calling them on phone to check up on them. So that's compassion from us to others. And then we've got compassion from others to self. So others offering that kind of same response to us, calling us to check up on us, visiting us, thinking about us, even asking, how are you doing today? That's compassion from others to us. And then we've got self-to-self compassion, which tends to be the hardest for people, actually, being able to kind of stop and then think about ourselves. Because I've heard this quote, which I was like, whoa, that's actually true. The person said that your eyes always look forward, and so it always thinks about others before self, because its position is outward, isn't it? So it's always easier to think about others before we think about ourselves. And so self-to-self flow of compassion kind of helps us to be able to pause. Yes, of course, it's good to think of others. It's good to receive what others have for us, but then it's also very important to think about ourselves and how we can look after ourselves. Because, the saying, you can't pour from an empty cup. You need to be able to be full yourself, or to be well yourself, to be able to go out there and support others, regardless of your field, even as a mother, even as a sibling, even as a parent, even as a spouse, and even as a friend. You need to kind of be in a better position so that you can be those things to other people. And so, I guess saying that, I just wanted us to pause and be able to reflect on that comment of self-to-self compassion. And if you can, just take a second to say something nice to yourself, because that also is part of that self-to-self compassion. Maybe it's like complimenting yourself that, I've actually done well today, or, my food that I made was actually quite good. I'm a good cook. So let's not just take a minute, not a minute because we've not got a lot of time, just few seconds, like 5 seconds to think of a compliment and then say that to yourself. You can say, I'm beautiful. I'm actually handsome, I'm actually good at my job. Just say that. And maybe you can put it in the chat. Maybe you can put that in the chat just to affirm that for yourself, and maybe for others to affirm that for you. So feel free to put that in the chat as well.
Yes, can you put that in the chat, please? Thank you.
So we are practicing.
Yeah.
We are practicing that psychology intervention even from now, even from this presentation. And so please put that in the chat. Maybe Shola can help me read out what you've put in there. And so just say something nice to yourself, or you just tap yourself. Just say well done, even if it's just a well done. Is that little? Well, it's not little because your body will receive that. It's a very positive thing. And so it's that kind of self-to-self compassion. Have you got some comments? Oh, you're muted.
Yes, I've got comments. I've got well done. I've got I'm wonderfully and fearfully designed by blessing. I've got Ola said you're lovely and kind.
Yes.
Omalara said I'm wonderfully made. Yes. Lola said well done to myself.
Yes.
Keep the compliments coming.
Yes, that's really good. And I like how you notice that kind of religious aspect of it, and then there's the more kind of.
Abby said, well done to me. I completed a 15K charity walk today.
Oh, good job. Well done. Well done from all of us to you. Yeah.
Omalara said, I'm beautiful.
Yeah.
Jesus said, Lord, thank you for making me me.
There you go. Yeah.
Antonio said, I'm highly favored and blessed. I'm honored. Yemi said, I'm amazing.
Oh, you are amazing. You are amazing. That is really good. Yeah, because when was the last time you said thank you to yourself? Like, we're always saying thank you to other people, but you did that. Like, even if it's your job, you put in the effort. You did that project. You did whatever it is. If it's parenthood, it's not easy, but you do that every single day, and you do it so well, regardless of how hard it may feel. And so it's important to always take some time in our day to pause and be able to show ourselves some love and some kindness and some compassion. So CFT kind of does a lot of work around that. And then we've got internal family systems. So we've got some examples there. But yeah, the key thing to every good intervention is that it's person-centered. So I guess thinking about it from the point of a therapist's point of view is that it should be kind of tailored towards that individual person to meet their needs, rather than just going on a general thing that, oh, we're doing this today, but making sure that whatever it is you're doing, even in conversation, even in kind of exercises that we tend to do in therapy, making sure that it's person-centered, trauma-informed, meaning that, you're able to recognize that people actually have got trauma from even services, mental health services, whether the availability of one or the lack of it. So being kind of mindful of that, and it should encourage a more positive behavior outlook. And so these are some of the things that kind of as therapists we think about or we kind of consider when we're working with people. And so yeah, I know a lot of people have fears around, oh, if I go to therapy, what's it going to be like? But it's just to kind of help to reassure you that, we're trained to kind of make sure that we follow these good tenets of psychology interventions. So yeah. So I guess with everything that has been said now, what would you think are some of the benefits to psychological support or mental health support? And with all that I've explained now, once, reflecting on the fact that it's not just clinical psychology, but even in our workplace, we've got organizational or industrial psychologists that can always come in to do some work with the team, thinking about team culture, team dynamics, team output or team input, and team well-being. We've got lots of different sectors. So feel free to put in your comments, in different parts, what would you think are some of the benefits of psychology? You can use the Mentimeter. Once again, we've got the code on the screen. You can scan the QR code, which is always easier to do. So improved state of mind, better health outcomes. Yeah, okay. Thank you for that. Yeah. Anyone else? Good coping skills. Yeah. Yeah. Anyone else? And when you think about these things that we have so far, when you receive that psychological support and now you're in a better state of mind, what comes out of that? What's the benefit of it?
Yeah, Michael, I've got some in the chat. I've got promote your health and well-being, builds resilience.
Yeah.
I've got Omalara said, help to stop and think.
Help to stop and think, yeah.
Antonia says, better awareness of yourself.
That's really good, yeah. That's really good. So yeah, that leads to this slide. You've all said all the things. So yeah, so that better understanding, self-awareness. Because if we know ourselves, we'll know how best to be in relationship with other people. We'll know how best to work with our clients. We'll know how best to do the things that we need to do, the things that come away every day. It gives a better understanding of the past, the present, and hopes for the future. So yeah, if let's say you've been through a very traumatic past, whether, regardless, for whatever reason, it's in therapy, we're able to kind of help process, those things, because sometimes it leads to flashbacks. It's, it can be present in our dreams or with nightmares as well. There's a lot of kind of effects that has on us, physically and mentally as well. So through therapy, we're able to kind of help process it, you're guided to kind of process it, and yeah, it makes you live better in the future, and then kind of help you be able to envision a brighter future for yourself, knowing that, okay, this is being worked on. I can handle whatever pain and regret and shame that have come through the past. But then now I know that it doesn't define me and I can still move on and do better in the future. So it helps with thinking that way. We call that a growth mindset, being able to kind of think about challenges or difficulties in a better, more healthier way. Safety net, it provides that safety net that, people feel, even the thought of knowing that I've got someone there to listen to me in itself, it's an intervention, a health. And so we've got that shed light on situations, because some people are like, oh, why am I like this, or why do people treat me this way? And so kind of, through therapy or through psychology, you're able to kind of have more clarity on certain questions that we may have for ourselves or for others. And someone said in that kind of Mentimeter as well, we develop coping skills. So, assistant psychologists like me, we do a lot of coping skills work. We do a lot of goal-based interventions. And then it helps to soothe us. So even the exercise we did just a few seconds ago, being able to just pause and think about ourselves, how good we are, like how did that feel to even do that, So even through this conversation, look at the benefits we're getting from psychology, and imagine actually sitting in a room with the psychologist. Think about that. Helps to develop self-awareness, so we've got that in the chat. Improve relationship with ourselves, with others, empowers us to feel situations. Like we get to learn that, oh, I'm actually resilient, I'm actually strong, I'm actually these are my strengths, and so we go in there into lots of different tasks with that confidence that, yes, I can do it because I have realized these strengths that I have. Helps us process racial trauma. So unfortunately, people like us in spaces like, UK, Europe, wherever in the world, even not just racial, even like ethnic trauma, because I know sometimes even within our African countries, there is that kind of ethnic divide or tribal divide. And so through therapy, we're actually able to think about these things. Why are they occurring? What does it feel like? How do we overcome, or how do we live in it? Thinking about that. So, psychology helps that. And eventually, we have a better life. We have a healthier life, to live life to the fullest. Is that not what we all want to do? We go to work to make money so that we can live a good life. We can put roof on our heads, have good food to eat, travel. And eventually, if we go to psychology, so a lot of times we think about physical health. But actually, our physical health impacts on our mental health impacts on our physical health. And so we have to take care of both sides, Same way we think about our spiritual health and making sure that that is good, reading our Bibles, praying for those who are religious, In the same way we think about lots of different aspects of life, we have to also prioritize our mental health. And so, when we access psychology, it helps us have that kind of good healthy mental life. In general life as well. So thinking about the benefits that we get from psychology, but what does research actually show us? Are we accessing those help that help provided? Are we actually looking into it, or why can't we access that? What are some of the barriers? So research has shown that Black people are 3 times more likely to experience psychosis. Psychosis is it's kind of the experience of we call that with psychology like to sometimes term that unshared experiences, is where we so for instance, someone might say that, oh, I see this person here, but then other people are like, oh, what do you mean, are you mad? I guess an African term would say, are you mad? But it's like, I don't see that, but then to that person A, there's actually something there. So it's kind of hallucinations. There's delusions where you believe a thought. Someone may believe that, oh, I am President Obama, or I'm the President of the UK, but they may not actually be. And then all of those bits, that's all part of kind of psychosis, or they may say you're having a psychotic episode. It says that Black men are 3 times more likely to experience psychosis, and Black women are more likely to experience things like anxiety and depression compared to their white counterparts. So some of these research focus a lot of kind of Blacks living in a white dominant world. And then we've got people from minority ethnic groups, be it Black, Asian, people of color, are more likely to be compulsorily detained under the Mental Health Act compared to their white counterparts. So remember I talked about inpatient provision of mental health support. So it's showing that sometimes, because the system or the therapist or whoever is doing assessments may not necessarily understand maybe the kind of cultural bits of us or the racial bits of us, because even in physical health, some of the parameters are not accurate, some of the parameters that may be used for our white counterparts should not be used for maybe us as Black people, or even for ethnic minority, because our make is a bit different sometimes. So I think with BMI, measuring BMI, there's a bit of a difference. And so, if you use maybe a white scale, you sometimes be placed under obesity. But then if you use using a black scale, yes, there may be some obesity, but then the figures may be a bit different from if you use. So you have to always think about kind of the population or the race or the ethnicity of the person that you're working with. But unfortunately, sometimes this is not considered, and people like us are wrongly detained or admitted into hospital because of lack of understanding. And then experiences of racial oppression, social and ethnic inequalities, and other stresses like poverty contribute to a higher risk of mental health in blacks. We've got 1 in 8 Nigerians develop a mental health condition during their lifetime, and less than 10% have access to mental health care. So this is the WHO, the World Health Organization. So let's just pause here right now and just reflect on this. Because when I see stats like this, it makes me think that, whoa, it's actually a lot going on for us. And be it that, due to unfortunate circumstances that happen to us, or through the systemic issues, there's a lot going on there. Just take a minute to pause and reflect on what I've just read out and what we see on the screen. So I know I've mentioned some of the barriers to access, but what do you think is happening? Why do you think we are seeing some of these figures? I just want to ask the room. Feel free to put it in the chat. It's not meant to me to for this question, but feel free to put in your comments in the chat. What do you think is going on? Because even in Nigeria, I've seen 1 in 8 in Nigeria, and I don't think it's just Nigeria. I think even in Ghana, we've got a lot of people actually going through mental health conditions. But why do you think they are not accessing psychology support? Why do you think they are not coming forward? What do you think is going on?
Right. I've got stigma, cultural bias, stigma.
Yeah.
Yeah.
Yeah. Yeah. That's
common. Social stigma.
Yeah.
Stigma is at the forefront.
Yes.
Stigma.
Yes.
Yeah.
I think that's a very big one, and that's why I put that first. Is that cultural
awareness?
Yeah. Lack of awareness, yeah.
Stigma?
Yeah.
Stigma is the number one. It's at the forefront.
Yes. Yeah. Yeah. It's that African mentality of whoa, there's something wrong with you. Some people use the term crazy or mad. Growing up, I would see a lot of people on the streets in Ghana, and then you because of how I don't know where it came from actually, but you notice that sometimes a lot of these things are linked to religion, because then people are then called a witch. They're like, oh, they've been kicked out of the witch camp, and that's why they're on the streets now. Or this is going on in the whatever world it is in the spirit realm. Or someone is doing something to them spiritually, and hence they are getting mad or crazy. There's that African mentality. I don't really know where it came from or where it stems from, but I think that's killing us. That's hurting us. That's
Of course, lack of education, Michaela, lack of medical support.
Yes. Yes.
These are the barriers in the charts.
Yeah. Yeah. And if we have that mentality, we start to think, oh, therapy is not for us. I'm fine. I can just pray away my problems. So, hey, as a Christian, Sophia, there's that saying. It's like, oh no, I forbid myself from getting anxious. I forbid myself from, falling ill mentally. We pray that away. But then actually, anxiety is a real life experience. So far as we're human, we say that there's joy in the Lord. Yes, there is joy in the Lord, for the religious folks, but there's joy in the Lord, but in that situation that actually make us cry. Why do you think God puts, that ability to cry?
I've got to help us. Sorry, Michaela, sorry to cut in, because you can see the charts and people are dropping in lots of perceived what they think are the barriers. I've got orientation, resistance to right support. I quite like that resistance.
So yeah, so it's that kind of thinking about, why, even not just even as a system or as a cultural thing or even as a community, but even for yourself, what do you say to yourself when you're feeling anxious? Do you think that, oh, do I need some support? Do I need to practice some coping skills for myself? Or do you just start, of course, yes, pray it away, do all of those bits, which is always great, but it's also thinking about what can I do? God gives us wisdom to handle different situations as well. So yeah, we've talked about, resistance, I have some kind of anecdotal quotes as well. It's like, why would you air your dirty laundry in public? Someone thinks that if I go see a therapist, it's like I'm putting all my family's dishonor and shame and blah, blah, blah on my own. I'm telling someone, what if I can't trust them? What if I go and tell my aunties and uncles, or what if they start talking about me elsewhere? And you become very, paranoid about it. And so that also falls into it. The strong mentality, there's a lot of, Africans that say that it's like, oh, just get on with it. Even, I do EDI work, and sometimes when I speak to some of our staff at work who have been racially abused, and I'm like, oh, we've got a process for it. You put in what we call in-phase, which is like a system where you get to record it, and then the higher ups, the executives and leaders can look at it and think together, what can we do to support these individuals? But yeah, people are like, oh, this is normal. We experience this every day. What should we do? It's like, just get on with this. But yes, you can get on with this. But then there's the effect that follows up sometimes. In psychology, we say the body keeps the score. So sometimes, even, even physically, it's like, you go through lots of days, every day comes with its own stress, its own worries, and it then builds up without you realizing. And one day you just have a big meltdown, a big outburst, and people are like, oh, where did that come from? It's because you've been keeping that days by days, and eventually it's like, no, I can't contain it anymore. You bring it out, and then it comes as a big, maybe psychotic episode, or it comes as a big kind of great anxiety that falls on you. So yeah, it's important to recognize these things. We've got language and communication barriers. I'm just thinking about maybe in the white-dominated areas, sometimes it's like that lack of understanding of, Black culture, like maybe even race or even language, even how we speak. Because I noticed, as someone who's lived in the UK for a few years now, I noticed that, they all kind of, people tend to speak quite similarly. It's like they express themselves quite similarly in things. It's like, for example, maybe when I was in Ghana, when I finished work, I would say, oh, I have finished from work today. But then I noticed that over here, if I say that, someone looks at me, it's like, wait, what do you mean? But here they'll say, oh, work is done today. So it's even in the way they speak, even in the terminologies they use, it's quite similar. And then when we use something outside of that, sometimes it can be quite challenging for some people to understand us, or even to understand what we mean. And even with, even some people may not. Yes, English can be, our official language for some of our African countries, but even we've got lots of languages as well, Igbo, Yoruba, we've got Chi, Fanti, all of that, and sometimes those terms come into play. It's like how you speak, like you say, oh, Charlie, let's do this, or like the pidgin, or like broken English, and people may not understand us, and in the way we may express ourselves, so that becomes a barrier as well. Lack of understanding of psychology or mental health support, lack of representation, or even lack of infrastructure as well. It's like, what are the hospitals, what are the clinics in Ghana or in Nigeria or in Zimbabwe or in, some of our regions? Like, where are they? How are we supposed to access them when they are not available, And even what is the government doing about it? It's like, are they prioritizing mental health? Are they putting in funding? What policies support that for us to even take a break from work, to even take leave? I noticed that some people actually don't take leave in Africa. It's like they just keep working all their lives. It's like, don't you stop? Are you not tired? Don't you need a break? Don't you want to go on holiday? It's like, you can't take a break. And when you take a break, you have to kind of like go and give gifts to your boss, and it's like, oh, sir, today I want to take this day off because there's a family function. It's like you have to beg to take leave. And when I grew up in that system, it seemed normal. But then now that I'm like a bit out of the bubble, it's like I'm thinking differently. It's like, yeah, what is our government policies? How do they support our ability to access mental health support? And it's also all of those things that, you've all mentioned in the chat as well. So what can be done? What can we do what can we actually do to make things better for us? So yeah, I guess for us in places like the UK, culturally sensitive therapy and therapists, so people kind of being aware that there are differences in how people speak, how people express themselves, and just being aware of that in therapy. Opportunities to train Black psychologists. So yeah, in the UK, so for instance, I am in that journey to become to call myself a clinical psychologist in the UK, I have to do the doctorate course, and even access to that. I'm an overseas person, I'm on a visa, and there's a lot of restrictions on that. The home students, so British citizens, are paid by the government to do the course, and so they are paid to go to the schools, to get the academic bits of it, to do placement. But overseas people like me, I have to pay to do the course. And even though I have to pay to do the course, there are only few universities that actually offer places, and those places can be 1 or 2 per year. So just thinking about that, the ability to even come into the field, that's a long journey, and that's a lot of barriers you're facing. And it's quite tiring sometimes, if I'm being honest, but you have to keep pursuing, be resilient, because you know that people like you need that help, people like you need that representation in the field. So yes, by God's grace, I'll get there eventually. And so yeah, it's just that kind of barriers in the first place to access or to get trained in it, and recruitment as well. And I think the other thing that needs to be done, that our governments need to think about, is support for our churches, for religious bodies, for our schools, for our workplaces, to provide mental health care. Because as I said before, I think Africans run first of all to their church or religious leaders for support, isn't it? Is that not the case? Do people agree with that? Yeah. I think that most often, like when someone tells me, like I call people back home and they're like, oh, like life is hard, or my marriage is suffering. What do they do first of all? It's just say, oh, I'm going to speak to my pastor. They'll counsel us. We'll get marriage counseling, all of that. But what are we actually doing to support our churches, or to empower or equip our churches with the right tools so they can support us? That needs to be considered. Our governments need to think about all of that. In our schools, from secondary school, boarding school. Boarding school is hard, So what are we doing to help our schools be able to better cater for our children, our families, our relatives, our friends? In the workplace, making sure that government policies recognize that taking leave from work is good for our well-being, things like that. So kind of support for things like that. And then we need people in leadership roles who are championing mental health. It's just an important aspect of life. We need our leaders talking about it. We need our leaders doing something about it. And even while we are kind of, I guess, being outside of maybe Africa, being in places like the UK, as most of us on this call are, being able to support EDI groups in our locality, because sometimes they do consultation. They need to know what's going on for you so they can take it up to Parliament. So I guess thinking about, the whole visa immigration rules going up now, they actually, the whoever it is in the government, they called us, there was a consultation, and people like us could go in there, for them to hear us, what we think, how we feel about these immigration rules. So we need to be mindful of it. What is the EDI group? EDI stands for Equity or Equality, Diversity and Inclusion. So there are usually lots of groups. Some people on this call are from London, Manchester. There are lots of EDI groups around. We've got ALAFIA, which is more accessible. It's not just in a particular place, but you can access them through online platforms. So being able to look at that, what is the EDI group available in my community, and how do I make my voice heard to them so they can then kind of springboard my voice and my thoughts and my comments to our MPs, to our kind of our mayor in the area, all of that. And I really like that, the mayor of London has been going around lots of different African countries. He was in Ghana this year, and the mayor of London, so it's also important that our leaders are trying to understand us so that they know how best to care for us. And peer whispers, so you kind of accessing psychological support and telling people that, therapy is actually good, this actually benefited me, this helped my relationship, spreading that good word to people, because there's a lot of gossip that happens, there's a lot of talking that happens, conversation, and being able to kind of pass on that good word through that and taking initiative. So even you yourself, going online, finding that resource, learning more about mental health, learning more about how you can support your friends, learning more about how you can take care of your own mental well-being, and then making space for people that come to you, for support, making space to listen to them and support them, rather than going in a judgmental way of, if someone says, I feel anxious or I feel tired, they're like, oh, stop it, what do you mean? No, rather than doing that, being non-judgmental, providing that safe space, that safe net, for them to actually open up. Because sometimes just talking about it, we say that a problem shared is a problem half solved, isn't it? So being a listening ear for people to kind of gain some well-being support from you. So we've got some quotes here to kind of finish off. You are not weak for struggling. You are strong for facing your battles head on. Mental health problems don't define who you are. They are something you experience. You walk in the rain and you feel the rain, but you are not the rain. So if you feel anxious, it doesn't mean you're an anxious person. It just means that circumstances have happened for you to feel anxious, to experience anxiety, but it doesn't mean that you are an anxious person. So yeah, please seek help when you need to. Please encourage others to seek help. And I really like this quote by C.S. Lewis, which says that you can't go back and change the beginning, but you can start where you are and change the ending. So maybe you're starting by reviewing your mindset, what's my perception of mental health, what's my perception of psychology. Start reviewing that and kind of letting that creep into your behavior and thoughts and feelings as well. I've got some resources. So, through kind of joining webinars from charities like ALAFIA, you're getting some form of kind of psychological intervention through this. You can listen to podcasts. I've got some podcast recommendations. Black Mental Health Podcast, I think they do a lot of kind of men's mental health talks on their podcast. It's Therapy for Black Girls. They're on Apple Podcasts, they're on Spotify, SoundCloud, so you can find them on there. We've got some books as well. I mentioned the quote, The Body Keeps the Score. So there's actually a mental health practitioner called Dr. Bessel van der Kolk, who's written a book on that. He actually is a psychiatrist, I believe, and he's broken out, he's explained that whole concept of the body keeps the score and used real life kind of examples, of course, keeping confidentiality. So he's talked about that subject. And then there is Why Has Nobody Told Me This Before by Dr. Julie Smith. So she actually has like coping skills in her book that you can try. So it's quite handy. And then we've got The Pain We Carry by Natalie. So we've got lots of different resources available. And then I noticed I was searching specifically for a lot about kind of mental health support available in Nigeria. And then I found this group called MANI. They call it MANI. It's Mentally Aware Nigeria Initiative. And they offer counseling support for young people, so between 18 to 25. And then we've got Nigerian Mental Health, which is in Abuja. So I think they've got a base in Abuja. They also provide mental health services. You've got Mental Health Foundation, they are in Nigeria, the Ghana, which is a non-governmental organization, provide mental health services, policy reforms. So if, let's say, you're a manager in your team and you need kind of a link into mental health services and someone to help you refine your policies to make it more possible for people, for example, people in your workplace to take leave or all of those bits, they can help with that. They offer advocacy as well. And their aim is to kind of help reduce stigma and discrimination. And then in Ghana, so I've actually worked with this group, Corporate Wellness Consultancy. I did an internship with them and I still work with them. And they offer various psychology and psychiatry services to both the young and old in Ghana. They've also got basic needs. And while you're in the UK, if actively you need support, you can see your GP or you can call 111. So feel free to, we're coming to the end of this presentation. Please scan the Mentimeter code or QR code and put in your thoughts and reflections. With everything that has been said so far, with everything that has been shared so far, what is your take? What is your idea of mental health now? What's your idea of psychology? Do you think you've actually learned something different? You're thinking of psychology differently? What are you taking away? Are you more empowered to access support when you need it? So feel free to put in your thoughts or reflections, any comments, something that maybe you didn't know before, but now you know. So please please scan and put it on the Mentimeter, and we can all kind of see that and acknowledge it.
Thank you. And you can drop it in the chat as well.
Yeah. Have you got any comments so far?
No, I don't have any comments. Oh, well, I've got some. I've got no health without mental health. That is good.
Yes, I like that. I like
Yeah.
that. Yeah, yeah. Because as humans, like, we've got that physical aspect, we've got the mental health aspects. They're all parts of who you are, and it's important to care for both sides. Yeah.
I've got on the chat. Mental health is still a big stigma in Nigeria, so I'm guessing this individual could be joining from Nigeria.
Yeah. And it's helpful because it starts with knowing that there's a problem. Because if you're aware of the problem, you start thinking about how do I help solve that problem or fill that gap. And so now that you've got this information, you can start with the conversation with your friends or with your colleagues, like, oh, what do you actually think of mental health? You know, how do you care for your mental health? It starts with those conversations, and eventually it spreads. It's like everyone starts now thinking about mental health and how important it is. Eventually, you know, we are able to kind of work with, you know, charities like ALAFIA, you know, to linking with our leaders, linking with, you know, the government, you know, making your voice heard, that it is actually an important part of life. And yeah, so it always starts with that awareness and then that conversation that we have with people. So yeah, it's helpful, you know, through this, you know, hopefully, and yeah, hopefully in the next couple of years we can start seeing some changes. Because even if that, yeah.
I'm sorry, Michaela, I've got lots of chats just come through now.
Yeah.
Your health is your greatest investment.
Yeah.
Black people don't see stress or anxiety as mental health. It's okay not to be okay.
Yeah.
You know, seek help, talk to the right people. It's okay to talk to a therapist, even if you're a black person.
Yeah.
It's not a white person. White people think.
Yes.
Be black, be bold, you can.
Yes, I like that.
People don't want to talk about it, so many hide in themselves. All I said, I like this, raising awareness and talking about mental health with friends. Yeah, because I don't know if you know, that's one of the problems in this part of the world. Even GPs don't see psychology, you know, as something black people are readily receptive to. So if a black person goes to see their GP and they say, oh, I've been feeling you know, in my mood and I'm suffering with this anxiety, and we know that the first, you know, signposting or the pathway should be talking therapies, but GPs do not see Africans readily accepting that, so they would rather give Africans medication. So this is why we need this awareness, so people know that it's actually okay to talk to us, you know, go for talking therapy.
Yeah.
Yeah.
And you can challenge your GP, you know, knowing that there's actually psychology available. You can challenge a GP that knows, you know, therapy, talking about things is also important, because, I mean, your GP should know that in the first place. But if they're not providing that, you can challenge them to say that this is what I want, this is what I think would be helpful, and hopefully, you know, you get a good GP in your surgery wherever you are. Yeah.
So I've got, once you talk about it, they literally see you as a mad person. That was in the chat.
Yeah.
You did mention that about airing dirty laundry. Yeah.
So first of all, we're working on ourselves, isn't it? We work on ourselves and we can start having our conversations with people. The same way that now you're thinking differently about mental health. Hopefully, as you're having that conversation, bringing that awareness to people in your circle, hopefully that helps to kind of little by little change that narrative on mental health in Africa, in our parts of the world.
So I've got, I know we're rounding up now. Thank you all so much. We're actually running over, but thank you all for still staying sometimes you can have too much of a good thing, isn't it, Michaela? So
Yeah.
thanks all for staying.
Yeah.
I've got very quickly, I'll read this and then we can round up. Psychology is the first line. It's as good as medication,
Yeah.
required in simple cases. Got thanking you, Michaela. Stigma remains an issue. And somebody said people should look at it as same as diabetes. Yeah.
Yes.
Physical
Oh, I
and-
like that.
yeah.
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 Yeah. So thank you all for your
Thank
comments,
you.
for engaging in today's conversation. I put Medase, which is like a Ghanaian Chi language way of saying thank you. And so just, I guess, embracing a bit of me and teaching you a bit of me, which is Medase, so which means thank you. So thank you for your time. Thank you for listening to me. Thank you for engaging. And yeah, feel free to, if you've got any questions, it's not got a lot of time now, but feel free to send it to Shoreline, the ALAFIA team, and yeah, I can
Yes,
respond wherever I needed.
absolutely. I'm so sorry again, Michaela, for coming in. I've got questions. Can you put your questions in, or do you want to unmute yourself?
Yeah, you can unmute yourself.
Quick questions, yeah.
Questions?
Yes, please, yes.
Yeah.
Okay. Sometimes does having unbalanced religion lead to suspicion of mental illness? Somebody was telling me that he was called to talk to somebody who was sectioned, and he found the person was a believer who thinks he's a millionaire, that he was owing loads of rents and everything,
Yeah.
but kept telling people he's a millionaire, that the Lord made him a millionaire. So he actually had to, because he's a Nigerian, he actually had to talk to the authorities that this person is really not really in that, they didn't quite understand, that he understands him. And in the end, got the person released.
Yeah. So you notice that with psychosis, a lot of it is kind of unprocessed thoughts or memories. So as you said, there's like that conflict. First of all, in reality, it seems the person's in debt, but what is the person thinking? That I'm a millionaire. And so it's like the things he wants, so he's still processing the fact that he's in debt. Probably he's still processing that. But then, of course, it's that religious aspect. And that's why we need that kind of awareness even in our religious circles, to let them know how to support people. And he's thinking that way because, yes, first of all, that's the first line of response, isn't it? He's like, oh, I have to pray to God, I need support. So even though it sounds that, like, yes, it's a psychotic episode, in his mind, he's trying to get help, but trying to process what's happening to him. So there's a lot that can be at play there. And I see a lot of that even at my workplace. People start to say that I am God, I can care for myself, or, I am rich, when actually they're going through a lot of financial difficulties. And it's all unprocessed memories. It's all the things we would like to see happening in life, which is hard to deal with, hard to reflect on. And because they may not be able to do that without some guidance, it's then coming in or presenting itself in that way. And so, yeah, sometimes, I actually worked with someone who said that he was like a chief. You know how sometimes in the African communities we call the chiefs and the tribal leaders, blah, 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 and said he was that. And, people are like, oh, are you crazy? And actually, yeah, like similarly to what your friend did, I actually went to tell the practitioners that actually that happens in African countries, that we've got chiefs and tribal leaders, blah, blah, blah. So, yeah, given that awareness that, these parts of this, some parts of what the person may be saying may be true, but other parts of it is still the unprocessed memories going on for them.
Yeah. And to add to that, it's about culturally, appropriate care,
Yes.
knowing about the cultural background
Yes.
of the individual before you start to make a plan for their treatment.
Yeah.
Yeah, absolutely.
Good.
So Ola has a question. Ola, are you typing in the chat, or do you want to unmute yourself?
I'll just unmute myself. Thank you, Shola. Yeah. One of the questions, and you just mentioned it actually, Shola, that, the cultural awareness, because of the way we grew up, especially if you're Nigerian or I suppose Ghanaian as well. I've watched some Ghanaian movies, and, we're all into these witches, and, village people are doing me, So now you're having a breakdown because something in your family has triggered you to have a meltdown and you needed help, you reach out, and obviously, you're here, and we don't have many Black psychologists, I don't think so, or that has experience of, our culture and where we are coming from. So immediately you start talking to them about what you're going through, they're just looking at you and thinking, okay, you're not making sense. So I think that's one of the reasons why we don't access because there's that gap that has not been bridged yet. We are not, because we don't have people that I can talk to that will understand, because we say it a lot, village people, that your village people are doing you, and we've gone to that extent that we've believed, we believe it so much that, they followed me here, that's why I'm not progressing, or that's why I'm not doing this. And, the white people as well, if you look at their history, they too also had, witches, and they were burnt at the stakes before they moved away from that. But we are still in that in Nigeria. We're still in that in most African countries. We're still with that mentality. And when we try and, speak about it here, they're just thinking, oh, did you go to school? Why are you believing such nonsense? That's not real. But it is the way it is. And I don't see it getting better unless we have more people coming up that are, like yourself, Michaela, that is actually have that background and, can help and say, okay, I know what you're talking about, but, this is the way to approach it and this is the way to get better, or, I don't know. That's just the way I feel like. There is no understanding. If I'm speaking to a white person and I'm talking about what I've gone through or what I'm experiencing, they're not going to understand it because they don't have that cultural background of what I'm speaking about,
Yeah, I completely understand what you said, Ola, and it's something I think about actually quite a lot, and it's part of the reasons why I'm so passionate about kind of working my way to be a qualified clinical psychologist. And as I was saying before, the process for people like me to get into the field is quite daunting, it's quite hard. But yeah, we're still pushing the barriers, we're still working our way, and eventually there'll be more people like me that you would meet in a therapy room that can be culturally, understanding of what you may be going through and provide the right intervention. But yeah, I guess just that kind of with that, with EDI forums, even with the EDI work I do here in the Wigan Borough, we've tried to make people understand it, or I do that, even with my supervisor, who is white, or even with like the team that I work with, which is predominantly white. We had a Ghanaian patient, and I think there was that kind of, why, I think there was some suspicion, like, I don't know, around the case, and there were times where I'll be in the room and I'll say no, because this is how things are done in Ghana. So sometimes we just need someone in the room who would say, but this is how things are done in Nigeria. It doesn't mean it's always okay, the things that are done, but then it's that awareness that actually this is considered something that may be considered normal in the parts of the world that people are coming from. If you were to think differently around it and think differently around the care plan that will be provided, and so hopefully things get better. I mean, this year I know that they've added, University of Bath has added to, I think, the 5 or 6 schools now that offer places for people like me. So hopefully eventually every year there'll be more universities that join the list and can provide more opportunities for people like me. But we are a long way from that, but small steps every day, isn't it? So hopefully we get there. But yeah, thank you for your question, Ola. It is important.
Yeah, absolutely. Thank you, Ola. And to add to that again, and that's one of the reasons for the birth of ALAFIA. And I don't want to go into too much story. It's all on the website. This is the reason why ALAFIA came to birth. Seeing the outcomes for Black people when they come into the system, how very poor the outcomes are, and how Black people are overly medicated. And that's another talk for another day.
Yeah.
So it is one of the reasons why I was so like, this isn't right.
It's like, because they don't understand, it's like, I'll just give you meds for you to start out and then live,
have not even tested in black people, and yet they overly medicate black people. The same thing. So when you say a black person having a mental health difficulty, because there isn't that awareness, you don't get that therapeutic rapport that you need. So if you go to your psychologist, they probably are not going to understand what Ola just said, because they have no, awareness of what's happening back home. So this is why we need this to keep at the campaign and promote this awareness. So thank you for that. And I think those are all the questions. But somebody, just one more last question, and then we round up, because I'm very much aware that we have done the African thing. We've overrun African time. So I do apologize. So I've got Babajide. He has a question. Babajide, do you want to unmute yourself?
Yes. Good evening, everyone.
Hello.
Thank you for the platform. I came very late. I'm very sorry about that. But my question is, can we have a record of this, so that I care for listening purpose and
Yes, I can answer that. It is recorded. It is on the website, www.alafia.org. Yeah, so you can get that from the website. Yeah, it is recorded. Yeah.
Okay.
So thank you for joining, and I think that's all the questions for now. So yeah, thank you so much. I would like everyone to join me in saying a big thank you to Michaela.
Thank you.
It was so good. It was so well presented. Thank you, Michaela. We're
Thank
so
you.
grateful for taking your Saturday evening to come and do this with us. We're so grateful. And many more, and we're very hopeful that you will get that clinical psychology placement so that we can have you back. More things, ALAFIA. Yeah, we can see the future. Yeah. Thank you.
Thank you, Michaela.
Thank you all very much.
I will teach you more Igbo words than the Tofiakwa.
I actually didn't know it was Igbo. It's something that we say, but I didn't know where it came from. So yeah, now I know.
Thank you all so much. Thanks everyone for joining this webinar. And we hope to see you at the next one. So watch this space. Thank you, Michaela.
Thank you, Shola. Thank you, Shola, and thank you to the ALAFIA organization, and thank you everyone for having me today. It's been great.
Thank you so much. And good night, everyone. Be kind to yourself. Remember.
Thank you. Bye-bye. Bye.
Bye.
Bye. Bye.
Bye.